Welcome to the Healthy Matters podcast with Dr. David Hilden, primary care physician and acute care hospitalist at Hennepin Healthcare in downtown Minneapolis, where we cover the latest in health, healthcare, and what matters to you. And now, here's our host, Dr. David Hilden.
Hey everybody, it's Dr. David Hilden, and welcome to the Healthy Matters podcast. This is episode 11 of season 5, and I thank you for tuning in. You know, there's been a lot of talk lately about GLP-1 medications, and these drugs are getting quite a bit of attention because of their role in diabetes care, weight management, and other uses. So we're going to break down what these new medications do, how they work, who they're for, and just as importantly, who they may not be for. Today, I'm joined by a doctor of pharmacy, Dr. Maureen Martin. She will help us break down GLP-1s. Maureen, thanks for being here.
Thanks for having me.
Okay, so a lot of people are hearing about these GLP-1 medications these days. So to start us off, what are they in the most simple terms?
So GLP-1 stands for glucagon-like peptide 1, which is a hormone in the body.
Glucagon-like peptide 1?
Yep.
Got it.
Yep. So that's a hormone that's released in the body from the gut after you eat. And these medications mimic that hormone. So if you think of a hormone as a key that goes into a lock, these medicines are like having a copy of the key.
Oh, that's good. I thought I knew what they were. That's actually better, having a copy of the key. So how do they work inside the body? What does that key do?
So the hormone attaches to a receptor. So that's like the key opening the lock. And the receptors are located in a bunch of different places in the body. So these medicines were originally created to work for type 2 diabetes. So for type 2 diabetes, they're working on receptors in the brain, in the pancreas, in the muscles, in the stomach. So they're helping tell your brain that you're full. That way you stop eating. And then they're also maybe changing cravings you might have for certain foods. In the stomach, they're kind of slowing down how fast food moves through your stomach. So sometimes people feel full faster, feel full for longer. And then in the muscles, they're helping the muscles pick up more of the blood sugars and use insulin, which is another hormone, more effectively. And in the pancreas, they're helping the body release that insulin.
There's a lot of things they do.
Yep.
So to help listeners understand what we're talking about, I'm going to use brand names. We don't endorse any specific brand name, but these are drugs for you and me that are like semaglutide, dulaglutide, liraglutide. I'm trying to think of all the lutides. Yep. Those are what they are. But listeners, you might know them as Ozempic, Wegovy, Rybelsus. They have brand names. So why are they getting so much attention lately?
I would say in the medical community, they're getting attention because we keep finding new things that they're useful for.
Yeah, no kidding. They do a lot.
Yep. But more in everyday society, I think people are hearing about them partially because celebrities have used them for weight loss and have been talking about them. So they're on social media. They've drawn a lot of attention, both good and bad. So
yeah, late night talk shows hosts and Oprah's talking about them and all that. Yeah,
yep.
You do hear about them a lot in our media lately. That's not what they started for, though, was it?
No.
You started that to tell us about that, about diabetes. That's what they were developed to treat. Could you get a little bit more in before we get into the weight loss and other things? Could you tell our listeners who might know somebody or have diabetes why they're good for that particular condition?
Yeah, so they help the body release more insulin, and insulin is the hormone in the body that helps control blood sugars. They also slow down how fast food moves through your system, and diet is a big part of controlling blood sugars. So if these medicines change how much food you're eating or what kinds of food you're eating, then that can make a big difference with your blood sugars. Yeah, they're helping the muscles just take up those blood sugars and use the insulin that you already make or that you're giving yourself more efficiently.
Why was that better than what we were doing? There's 20 zillion medications for diabetes, not just insulin. But why are these different than all those? Why are they better?
So these more closely mimic how the body processes blood sugars by itself. So they can be less likely to cause dangerously low blood sugars. They can actually help control blood sugars more effectively. So there's a blood test that we'll do that helps tell us how well blood sugars are controlled called an A1C test. And we kind of base the effectiveness of some of these medicines on how much they lower the A1C. So for a lot of the older medicines, they'll lower the A1C by 0.5 to 1%, which is still
all those
good.
things I talked about that I've been doing
Yeah.
for 20 years. Yeah.
Yeah, so that's still good, but with these medicines, sometimes we can get up to like 2% reduction in A1C, which is more.
Yeah. Now, these are injectable, right? There's some oral forms too.
Yes.
But they're mainly injectables. Could you talk about how they're given?
Yeah, so they are injected. They're injected just under the skin. So it's not like getting a flu shot. It doesn't go into a muscle, and it's not like an IV injection. It doesn't go into a vein. It just goes into the fatty tissue just under the skin. So you can do this yourself at home for a lot of
It's
these.
not every day for most of them.
No. There's one medicine still on the market that's every day, but for most of these medicines and the ones that we now use more commonly, they're once a week.
And people can do that at home.
Yep, they can do that at home by themselves.
So when did we start noticing that these things do more than just treat diabetes? How did that come around?
So part of it was just we were using it to treat diabetes and people were reporting, hey, I'm losing a lot of weight, or we were checking weights in the clinic and noticing that pretty consistently people were losing weight. And then there's also other benefits that we found, particularly for the heart. And part of that was discovered because all new diabetes medicines have to go through additional studies to show that they're not harmful to the heart, because having diabetes can already put you at greater risk for problems with your heart. So we do these extra studies to make sure that the new diabetes medicines that we're using aren't going to cause any problems with that. And in those studies, these medicines did so well that they actually showed benefit for the heart.
Not only were they not harmful, but they were helpful.
Correct.
So they're good for your A1C, which is another mumbo jumbo of letters and numbers that's short for glycosylated hemoglobin. It's easier to say A1C. They're good for that. They're probably good for your heart. They make you lose weight. These things, they're pretty good. So isn't science wonderful, folks? I'm telling you, if you're ever wondering why we have a federally funded scientific community or why we have an industry-funded scientific community, one of the massive successes of science are these GLP-1s. In my career, I'd put it in the top 3 medications that have been invented in the last 20 years that have changed the course of human health. So just a little plug there to support your local scientific community. So now we're on the weight loss aspect of these GLP-1s. How do they do that?
So again, it kind of goes back to what are you eating? How much are you eating? Because these medicines slow down how fast food moves through your system. So people tend to feel full faster. They don't eat as much. And in the brain, it also helps activate that feeling that you're full. So it tells your brain that you're full, sometimes with smaller portions. And for some people, if they crave certain unhealthy foods, these medicines can help reduce those cravings.
Okay, so going back to some brand names, because they're out there so much. We hear about Ozempic, Wegovy. And I'll tell you, listeners, Ozempic is the medication to treat diabetes. Wegovy is the medication to treat weight management. And I'll also tell you that they're both semaglutide. They're the same generic medication. So, Maureen, talk to us about that. What is the difference between those two medications? Because you need to get one or the other for those two things.
Right. So the main difference is how much of the medicine you're getting. With Wegovy, which is the weight loss medicine, we use higher maximum doses. So the first few doses you get are actually exactly the same between the two
Little bitty
medicines.
doses.
Yep. So we start off with little doses, and then over time we increase the dose after we know that you're not going to have a lot of bad side effects with it.
Is that the reason for the little bitty doses?
Yep.
Because you don't leave people at those doses.
Right. Yeah, so that very first dose that people take is really just meant to make sure they're not having side effects. And then that second dose, we see some benefit, and then as we go up in dose, we see more and more benefit typically. But when we get to the highest dose, really the highest 2 doses, that's where there starts to be a difference between how much you're getting with the Ozempic versus the Wegovy.
Okay. Are they intended to be used all by themselves for weight loss? Here, go take this. I'm going to guess the answer is no. You have to do things in your life as well.
You would be correct. So these medicines, while they are really helpful, are just one tool, and really making sure that you're living a healthy lifestyle, which means eating healthy foods, getting plenty of exercise. Those are all really important to make sure that both for blood sugar control and for weight management, that these things are going to work.
That actually worries me as a primary care doctor. When I talk to people about these medications, we have a conversation. Folks, I'm not just going to prescribe this and walk you out the door. We have conversations about making sure you eat healthy foods. You could still have malnutrition while you're on these if you eat cruddy foods and just eat, that's all you eat. So I have a long conversation about what's going on in your life. We do close follow-ups. What I worry about is sometimes that these things are just kind of everywhere now in the media. And everybody wants to be on these things because I've got a wedding coming up in 6 months, or I'm taking a trip to the Bahamas and I want to be on the beach. And so I'm going to take these things as a quick fix. It's not how they work, is it?
No, they're not intended to be quick fix medications. Kind of like we talked about earlier, we start at these low doses and we only increase the dose about once a month. So we want you to take this medicine for 4 weeks before we increase the dose. So that part is not going to be super quick to get you up to these higher doses. It can take multiple months to get to these higher doses. And then these medicines can have side effects. So we do want you to have a conversation with your doctor about whether this is the right medicine for you to be taking. And we can see big drops in weight, and sometimes even too much of a drop in weight. So
we are talking with Doctor of Pharmacy Maureen Martin about glucagon-like peptide-1 medications. And I encourage all of you listeners to work that into a sentence at your next cocktail party. They're more commonly known as GLP-1s. We've covered what they are currently being used for, but there's so much more to discuss, including those side effects, as you just mentioned. When we come back, we'll shift gears. We'll talk about other conditions they are being studied to treat. So stick around. We will be right back.
When Hennepin Healthcare says, we're here for life, they mean here for you, your life, and all that it brings. Hennepin Healthcare as a hospital, HCMC, a network of clinics in the metro area, and an integrative health clinic in downtown Minneapolis. They provide all of the primary and specialty care you'd expect to find, as well as services like acupuncture and chiropractic care. Learn more at hennepinhealthcare.org. Hennepin Healthcare is here for you and here for life.
And we're back talking about GLP-1 medications with Dr. Maureen Martin. She is a pharmacist at Hennepin Healthcare here in downtown Minneapolis, where I am privileged to work as well. So let's talk about safety, side effects, costs, that kind of stuff about these medications. Are they generally considered safe? What are some of the downsides of GLP-1s?
Yes, these medications are generally considered safe if they're being used as prescribed under the supervision of a healthcare provider. But they do have side effects. Any medication can have side effects, whether it's over-the-counter or prescription. So with these particular medications, more common side effects are things like nausea, vomiting, constipation, or diarrhea.
Those are kind of typical for a lot of medications, are they? Do they get better with time? Is that what, you're starting on this little wussy dose that barely does anything anyway. Do these get better with time, or every time you have a dose increase, which happens every month or so at the beginning, do the side effects just carry on? Or is it something you have to live with, or do they get better?
Well, it depends on the person, but we're more likely to notice side effects every time we start the medication or increase the dose. So that's when they're more common. For some people, once your body gets more used to the medicine, those side effects go away, or they might still be there, but they're not as bad as they were at the beginning. But for some people, those side effects don't go away, and that's when we might say this isn't the right medicine for you.
What do you tell people who are squeamish about needles? Because, I tell people this. I say, okay, you're going to do this yourself, and you're going to stick this little needle under your skin, and their eyes get bigger with every passing sentence that I say. A lot of people are kind of squeamish about needles. What do you tell them?
With a lot of these newer medicines, it's once a week. So sometimes that makes people feel better that they don't have to do it every day. We also have demonstration pens that we'll use in the clinic. So I'll let them see what it looks like, try it out, inject into a cushion so they don't have to inject it into themselves, and see, do they think they could do that at home?
Does it come in a pen form?
It does.
I prescribe these things and I don't have any idea. Isn't that funny? Your doctor often doesn't know with a lot of detail about what the thing looks like. Your pharmacist does, though. So I'm going to pick your brain. It comes in a pen form? Has it got a little clicker, or how does it work?
Well, it depends on which medicine we're talking about, because each medicine has a different kind of pen. So some of them look really similar to insulin pens. Some of them, you don't actually have to see the needle at all, and you can just push a button. So if people are really squeamish about needles, sometimes
just put it on your skin and press the button.
Right. Sometimes I'll try to get that one where you don't actually have to see the needle, but that kind of depends on what the insurance is willing to cover.
what part of the body do you put it in? That sounds like a basic question, but people have asked me that. And I said, I think you put it in your belly.
Yeah, so most people do it in their belly, usually a couple inches away from the belly button, just because there are more nerves right by the belly button. So it's more uncomfortable to inject really close to the belly button. But you can also do it in the back of the arm or in the outsides of the thighs.
So an area that's sort of softer, fattier tissue?
Correct.
You're not sticking it right into your arm muscle when you get a flu shot. And the needle is little, right?
Right.
Little bitty thing that just goes under your skin. I do find that people tell me, even the squeamish ones, okay, I did that for a couple, 3 weeks. It's no biggie. Usually even the ones who were nervous about it said, yeah, that was a little bit weird the first time and the second time, and now it's not weird at all. And that is for people who don't like needles. So it's pretty easy to do.
Yeah, and it can also be more comfortable if you get the medicine to room temperature, because often these are stored in the fridge.
Really?
Yep.
Ooh, that's a good tip.
Yeah.
But you can't leave them out, though.
I wouldn't leave them out. I think most of them are technically good for about a month out of the fridge, but
Follow the package instructions.
Right.
But I like that. You can bring it to room temperature before you inject it. It might be more comfortable. Are there certain people who should just not take these medicines? Are there some pretty strong contraindications?
there are. The contraindications, so people that absolutely should not take these medicines, are people with a personal or family history of medullary thyroid cancer or a rare genetic condition called multiple endocrine neoplasia 2.
MEN2.
Yep.
Which I knew all about on that day that they gave us that lecture in medical school. But I haven't seen a ton of it ever since. So if you have MEN2, please tell your doctor.
Yep. So those would be conditions where we absolutely wouldn't use it. And then we also don't have a lot of information about these medicines in pregnancy or breastfeeding, so they're not typically recommended in those conditions either.
Those are some good tips. If you have that medullary thyroid cancer, MEN2, pregnant or breastfeeding, maybe you should think about some other thing during those if that applies to you. Okay, I'm going to turn to cost. Probably the biggest news story of these GLP-1s is that they're really effective. But the next biggest story is that they're really expensive. Could you address that? Why are they so dang expensive? And what do you see about how we can help people get them?
Well, without getting into the whole process of drug pricing in the United States, which
the economy of Denmark. Yeah, I heard that the economy of Denmark has to be measured in two different ways. If you include the GLP-1s in the gross domestic product of Denmark, it changes the country's total economic output because they're so big. Apparently, one of them's made in Denmark. Okay, say more about it.
Yeah, so without getting into the whole pricing of medications in the United States, which is a very complicated process, if you just look at the supply versus the demand for these medications, that it can explain a lot of it. These medicines right now are brand name only, which means that the companies that made them are the only ones that are allowed to sell them. So they control the supply. And there's a lot of demand for these medicines, both for weight loss, diabetes, and for other conditions. So if there's more demand and less supply, you can charge more for something. And that's basically what we're seeing right now.
But they're cheaper in other countries.
And that's where we get into the pricing of medications.
I'm totally prodding you
on
that. Because they are. They're a couple $100 a month in France, I heard, and they're $1,400 a month here. There is a lot we could unpack about the costs of medications, and I have a lot of thoughts on that, as you probably do too. What I would tell you is that you should just blame your pharmacist.
Well, I wouldn't do that.
I put that out there to see what you would react to that. What I really mean, folks, is don't blame your pharmacist. Also, maybe don't blame your doctor. We don't have a lot of control over that. And I will tell you right now, it is not your pharmacist. It is also not your doctor who's getting that money for these things. We wish we could prescribe them for all the people who need them. It's a big issue. It's a big issue at health insurance plans. It's a big issue for employers trying to cover health insurance when these medications can exceed $1,000 per month, which is just an eye-opening number, I know. Mm-hmm. Are there some programs for people, or are there resources we can do to help people where cost is a barrier, or is it pretty much one of those, I'm sorry, you're out of luck?
So there are some resources. They don't work for everyone, but there are discount cards. Those mostly work for people with commercial insurance or insurance that they get through their employer. Yep, it's basically a coupon. And with those, people normally still have to pay something for the medication.
Yeah, it brings it down to like $500.
Well, so some of them will say pay as little as $25, but these
have
coupons,
you seen that?
For some people it works. It depends on how much your insurance is covering to begin with, because these coupons typically have a limit to how much they will contribute towards the cost of the medication. So if your medication is a little bit more expensive than what you can pay through your insurance, but your insurance is still covering a big chunk of it, those might be be helpful. And then there's also these things called patient assistance programs. So these are for uninsured or underinsured people. Oftentimes they come with limits about how much money you can earn, whether or not you qualify for those. So those potentially can provide no cost, free medication. So those would be kind of the two.
It's probably
buckets.
At least worth asking,
right.
Where you get your health care, just to see, or asking your employer's plan if you're employed, or seeing if your public program covers it. I know a lot of listeners to the podcast are not in the state of Minnesota, so we can't say what the public programs cover, but it might be worth at least a question. Let's shift to the future. What do you see in the future of these? What are we still learning about these medications, or where the next steps are for them?
Yeah, so right at the beginning, we kind of mentioned how we keep finding new reasons to use these medications. So one of them is approved to actually reduce the risk of cardiovascular events, so like heart attack or stroke, in people with overweight or obesity, but who don't have diabetes. So that's kind of a really cool
So those heart
thing.
effects are real.
Yep. Yeah. So that's a big area that I know our cardiology clinic is very excited about. I've seen it prescribed there a couple of times.
So you might be told by your cardiologist about you starting a GLP-1 and you go, I don't have diabetes, but it might be for your heart.
Right.
You're carrying a little extra weight. We could really help your heart. That's specifically about the heart, not just in general. We know that losing weight's good for your heart. There's actual data on that. What about addiction? I've heard about that. There might be a role for it in addiction.
Yeah, so that's something that's being explored. We don't have a lot of really big studies that have come out about that right now, but it's been looked at for helping people quit smoking or helping people who have a problem with alcohol. So those are not official, like FDA-approved indications for this medicine right now.
Otherwise known as off-label.
Right.
That's what off-label means, folks, is when we prescribe things for something that it's not officially approved for.
Yep. And that's a pretty common practice to use a medicine for something it's not officially approved for.
Yeah, we do that all the time. That's not illegal. Off-label is a common practice. Yeah.
Right.
Are you seeing much of that with these?
So I'm not, partially because insurance doesn't always pay for off-label indications. So especially for brand name medicines, we don't see as much of that because people can't afford to get it.
I don't think I've written a
insurance doesn't
single
pay
prescription for a GLP-1 off-label because no one's going to pay for that. You have to meet very identified criteria. They have to have diabetes. They have to have a certain level of obesity. It has to be covered by their insurance. There's a few hoops we jump through to get these things before you actually get it in your refrigerator at home. Let's talk a little bit about kind of the marketplace out there for these things. They're all over the place. What are your thoughts about that? Should people be cautious about that?
I think they should be cautious about it to some extent because these medicines are only available with a prescription, but a lot of these telehealth services, they'll have you talk to a provider, but that provider doesn't necessarily know you very well. I think it depends on the service, how much interaction you have with that provider.
I'd worry a lot about that.
Yeah. Determining whether this medicine is the right one for you can be hard if you're not having a very in-depth conversation with the person that's prescribing it.
Yeah. What about the medication itself?
So there's a practice out there called microdosing, which means that you just use these really little doses of the medication. And those doses haven't really been studied a whole lot. So we don't know whether that's effective. We technically don't know for sure if that's safe, although if we use higher doses in a normal prescription, likely using a lower dose would not be dangerous.
There's not a lot of evidence of what that's doing for you.
Right.
I'd stick to what we know. That's my advice. Go to somebody you know. Go to your primary care. Go to a reputable place. Come to Hennepin Healthcare. We've got a reputable pharmacy. For all your pharmacy needs, I should say that you should come to Hennepin Healthcare if you're in Minneapolis. They're the best pharmacy in town.
We'd love to have you.
Yeah. Okay, before I let you go, if you could leave our listeners with one thought, one tip about GLP-1s, what would it be?
These medicines have a lot of uses and they might be really beneficial, but you need to have a conversation with your provider because they're just one tool in the toolbox. We want to make sure that it's the right tool to help you get where you need to be.
They're not a miracle.
Right.
They're really good, but they're not a miracle. I like that tip. So, Dr. Martin, thanks for being here on the show today to help us walk through GLP-1s. There's clearly a lot of excitement around these medications, but there's also a lot of questions, and it's great to have an expert to make it clear for us. Thanks for being here.
Yeah, thanks for having me.
And to listeners, I appreciate you tuning into the show today. We'll be back in 2 weeks' time for another great topic. So in the meantime, be healthy and be well.
Thanks for listening to the Healthy Matters Podcast with Dr. David Hilden. To find out more about the Healthy Matters Podcast or browse the archive, visit healthymatters.org. Got a question or a comment for the show? Email us at healthymatters@hcmed.org or call 612-873-TALK. There's also a link in the show notes. The Healthy Matters podcast is made possible by Hennepin Healthcare in Minneapolis, Minnesota, and engineered and produced by John Lucas at Highball. Executive producers are Jonathan Comito and Christine Hill. Please remember, we can only give general medical advice during this program, and every case is unique. We urge you to consult with your physician if you have a more serious or pressing health concern. Until next time, be healthy and be well.